decide today if this year will be about being a greater than or a less than practice, a greater than or less than, okay, when you work with your patient. So greater than says, okay, bigger vision, more comprehensive treatment planning, get them healthy fast. Okay, we want to be selling speed basically, right? Okay, or we want to be a less than. If we're a less than, if we're less than, we're going path of least resistance, lowest common denominator. You know, we're talking onesie, twosie, quadrant, insurance, whatever. Okay, so I'm telling you today, align everything in your life to be greater than. We want abundance mindset. We want to go bigger vision. So greater than versus less than. Greater than is where all the profitability is. Less than is where you get caught up in a volume trap. The second part of that, and it correlates, is are we focused on maximums or minimums? Maximums or minimums? Let me give you an example. Daily goals. Nice idea, okay? But the team sees that as like, this is what we have to hit. But if we don't, it's okay. We have to stop thinking about that. Those are minimums. Those are baselines. The daily goal is the starting point, not the finish line. The daily goal is the starting point, the baseline. I want you thinking maximums, maximum opportunity. Don't think about numbers. Don't think about statistics and procedures and all this things. Think about human beings. Think about the patient and say, if I go all in on my superpower abilities to help this patient in life-changing ways, what can we do for them, team? What can we do? Imagine if you take your phone team member and they learn to talk in maximums. They learn to talk in positive potential. Imagine if you take your clinical team, hygienist assistant, surgical assistant, all the people, whatever they are. Imagine if they take every patient and instead of talk about minimums, problems, where you are, why'd you come in, blah, blah, blah. What if we talked aspirationally about all the possibilities? Imagine, doctor, if you diagnosed to maximums, not minimums. Imagine if we presented maximum health opportunity. You hear the words? Do you hear the words? Because you've never heard them before. Maybe that's going to be my next book. But imagine if you diagnose and you talk to patients. Imagine if you present maximum health opportunity. Boy, that sounds a hell of a lot better. Then here's a few teeth we have to fix or work on. Here's what your insurance will cover. You had to come in, 8 times to make some progress in your health. Instead of, let's get her done quick and let's go all in. Okay? It's what you deserve. It's also what the market demands. All in. Complete. Concierge relationship. So I want you to think about this, because when we talk about the magic number, we are going to begin with the maximum opportunity. We're going to begin with possibility-based thinking for your life.